And I remember when I was pregnant, I went through really tough complications in my pregnancy that were not expected whatsoever. And I remember thinking to myself, here I am in the US with insurance, with the privilege and access to the best doctors. I can go get a scan of my baby anytime I want,
Yeah.
even out of my paranoia. And still, despite taking good care of myself, I still ended up in complications with my heart. And all I kept thinking was, if I was born anywhere else, or if I was living anywhere else in the world where we see crisis, whether that be Sudan, whether that be Gaza, whether that be even Nigeria, would I have had the same outcomes?
Right.
Would I have went home with a safe baby, and at the end of the day be able to recover fully as a mom and have everything I need for that experience? You know, who knows the outcome I would have had.
Welcome to another edition of Curated Conversations series by Nigeria Health Watch. This is really a monthly video series where we sit down with health experts, policymakers, and thought leadership for a focused conversations on issues shaping health systems today. And the aim is really simple. We want to talk about what is working, what is not, and what needs to change. And we're really excited to have you today.
Thank you.
We have an exciting guest today, the CEO of Every Pregnancy, Isra Chaker. Welcome to the Curated Conversations.
Thank you so much for having me. I'm really excited.
It's really amazing having you on the show today.
Me too.
So your foundation is you try to bring together Muslim philanthropists
Yeah.
to raise funds for women,
Yes.
issues around women. And just a couple of days ago, you were just named the winner of the nonprofit category
Yeah.
at Collective Continuum Spark Awards.
Yeah.
That's really amazing.
It was incredible. And it was the first time we'd ever actually applied for a
Really?
grant or a competition ourselves. And so we were chosen out of 2,000 applicants.
Wow.
There was 8 finalists and 4 in the nonprofit category. So I was able to go and pitch Every Pregnancy in front of a panel of judges and a live audience. And I'm very, very happy and proud to announce that we won. It was amazing.
Wow. But what was the outcome of that?
The outcome of that is a grant of $125,000 between institutional support and direct cash funding. And that's going to go directly, the cash funding, to procure supplies and equipment and medications for moms and babies who need it the most in crisis settings. And then the institutional support is going to support us in expanding and enhancing our partner platform to allow full end-to-end traceability from a donor giving funds to one of the partner organizations until they are able to trace the impact and give one place for all of this to live. So it's going to be incredibly beneficial for our organization. It's going to help us continue to accelerate and enhance impact. And we're just so excited for the visibility that this opportunity gave us.
That's really amazing. Congrats once again.
Thank you so much.
So let's just roll back a bit to how all of this started.
Yeah.
And for you, you started from being a global human rights advocate to now leading a faith-based inspired maternal health coalition. So just bringing back all of those experiences, I would like to know, how did those early motivations, how did they start for you, and how did it shape the journey that eventually led you to where you are right now?
Such a great question. You know, I often get the question of, how did you end up leading a maternal newborn health organization? Like, where did this passion come from? And I think it really starts first and foremost that even my background in human rights, this is a critical human right. I believe that women should have their rights met at all times, that no mom should have a not dignified pregnancy and a safe pregnancy. And more than anything, human life is sacred. And so the fact that we have a crisis of moms and babies dying from preventable complications in pregnancy and childbirth is fully aligned with my human rights background. So I think that's the first thing to say. But, you know, I was leading campaigning at Amnesty International, where I was focused in on advocating and building people power around the Gaza genocide, around supporting Indigenous leaders to get them freed from prison, around supporting Black individuals like Rocky Myers in Alabama to get him off of death penalty and death row. So my whole background has been about, how do we advocate and get the community and people to change how they think and how they take action around issues of consciousness and issues of human rights. And so when Every Pregnancy was started, it was actually another campaign. I was approached by leadership of the Gates Foundation, and it was really about solving this one question. How can we get the Muslim community at large to prioritize giving to maternal health
Right.
like they prioritize giving to food and water? And so that was a really important question because the Muslim community is the most philanthropic globally. They have the biggest giving power and they exercise that power, right? In Ramadan throughout the year. However, Muslim moms also have the highest maternal mortality rate. So Muslim majority countries are seeing the trends of moms dying at higher rates. So there's a disconnect here. So that question led me to design a campaign called the For Mama campaign, where I knew that the only way we were going to address this was by first understanding the landscape of the current world that we're functioning in the current nonprofit world and Muslim nonprofit world around maternal health, and then bringing together a coalition. So I knew that this was not going to be solved by one person alone, not one entity alone. It had to be a coalition effort. So every pregnancy was born out of that coalition that decided enough is enough. We have these amazing programs in so many countries. We're delivering impact and service to moms and babies, but we're not talking about it. We're not socializing it. No one knows how they can support it. And so for us, it was about providing a backbone, an infrastructure to this work that's already happening and giving one umbrella, one home as an ecosystem for it to accelerate, for us to enhance the work we're doing, but also to really track moms and babies' lives that we're saving because the impact is everything. And just to say from a personal standpoint,
Right.
I became a mom and that changed everything for me. And so in this journey, as I was at Amnesty International, I'd just become a mom right before that position. And I remember when I was pregnant, I went through really tough complications in my pregnancy that were not expected whatsoever. And I remember thinking to myself, here I am in the US with insurance, with the privilege and access to the best doctors. I can go get a scan of my baby anytime I want,
Yeah.
even out of my paranoia. And still, despite taking good care of myself, I still ended up in complications with my heart. And I remember being terrified over and over again, going to the emergency room, not knowing if my baby was okay, not knowing if I was going to be okay, and having a team of doctors supporting me literally till the end. And then I had my son, and it was a really tough delivery and then a really tough postpartum recovery period.
Yeah.
And all I kept thinking was if I was born anywhere else, or if I was living anywhere else in the world where we see crisis, whether that be Sudan, whether that be Gaza, whether that be even Nigeria, would I have had the same outcomes?
Right.
Would I have went home with a safe baby and at the end of the day be able to recover fully as a mom and have everything I need for that experience? You know, who knows the outcome I would have had? But I know for a fact that the privileged experience that I had meant that I had an experience that moms and babies around the world don't get a chance to experience simply because of where they were born or where they live. And that's injustice to me. So every pregnancy is also fueled by a mama bear who's extremely passionate about making sure that every mom leaves the hospital or leaves the clinic or leaves her home birth with a healthy and safe baby. And that every baby has a healthy mom to take him home and take care of him or her and be able to provide those nutrients. Being a mom changed me in every way, shape, or form. And there's no greater blessing. And I recognize that privilege that so many moms don't get. And it's heartbreaking and devastating, but it's also preventable.
Right.
So I'm here to remind the world that we can fix this. This doesn't have to be the narrative. We don't have to accept the status quo.
Right. Thank you so much for sharing passionately
Yeah.
those experiences and stories from how we started to, what led to what you're doing now with every mom, every pregnancy.
Yeah.
So I would like to go back to something you mentioned, the campaign that you designed,
Yeah.
the For Mama campaign,
Yeah.
which actually raised $34 million.
Yeah.
So I understand a key strategy to that was your storytelling approach.
Yes.
And of course, I can see that from how you narrated this. You are really a good storyteller. But I was just curious to know that narrative shift from just focusing on the statistics and the numbers to actually showing what this means, the real faces behind. What have you learned from that journey, that experience of, doing advocacy that way? And how is it shaping how you design and implement advocacy around maternal health now?
Absolutely. I think the most important thing to move people to take action is first person stories. And one thing that we always strive to do at every pregnancy is humanize these numbers.
Right.
You know, we can think about the statistics. Every day, nearly 800 women are dying from preventable complications, right? Every 2 minutes, a woman is dying. So even by the time we're done with this interview, multiple women would have lost their lives tragically and completely preventably. But when you're able to contextualize it
Right.
with the story of Fatma or Selma or Sarah and her actual narrative, who she is, it reminds all of us first and foremost that these are not just numbers, but they're actual human lives.
Right.
And people who are loved have loved ones. And so when a mom dies tragically, it's not just her who's dying, right? The community and the family breaks down. It's a tragedy for everybody. And so the most important thing for every pregnancy is to humanize this journey and to also draw the parallels between that experience of a mom in Pakistan to a mom in Nigeria, to a mom in Syria, to a mom in Gaza, and even Black moms in the United States of America that are still facing health consequences and unfairness in the way that they're treated in our own health system. So for us, it was about drawing the parallels, weaving that thread with storytelling and first person perspectives. And it completely revolutionized the way that this campaign has been successful. I don't think we would have raised collectively over 34 million over the past 2 Ramadan campaigns if it wasn't for the storytelling, the visual storytelling, the photos and videos. But one thing that's really important to mention here around storytelling is every pregnancy is very unique in our approach.
Right.
I think typical aid organizations oftentimes lean into imagery and visuals that depict sadness, that depict pity, that depict needing support, and honestly call for white saviorism in a lot of ways, and trauma porn. And we stand so aggressively against that because, first and foremost, these people that we're helping, the beneficiaries, don't need our help. We have the privilege of helping and supporting them, but they are dignified human beings at the end of the day. And so it is critical for us at every pregnancy to show women and show moms and show families in a resilient way and a dignified way, one that shows their courage, one that shows their capacity, and one that shows their survival at the end of the day. Because a mom will take care of everybody else before she takes care of herself. And so we have been very much about also encouraging our partner organizations to also frame their work in this way.
Right.
Their maternal health projects should be framed from that lens. So I'm very proud of the storytelling and the advocacy that we do. I think it has made a tremendous difference. I think as you can see some of the impact with the numbers and the donations people give, but also you can see it from the way that people react to us, the way that people love our content, the way that people are learning from our content, the way that they understand and contextualize now what it really means to save a mom's life in any of these countries, and what that actually means for me as Isra in the United States to contribute to that movement.
Thank you. I mean, what you said about how people are portrayed,
Yeah.
in a dignified way is really important. And I can imagine you see that because you work a lot in the front lines.
Yes.
And like you mentioned earlier, even in crisis settings. And I think one thing that also reveals is sort of that difference or that gap between the policies that are made, even the commitment really,
Yeah.
at the global level, regional level, national level, and the realities on ground.
Mm-hmm.
So, being in that position to be in the front lines, engage with these communities, these women, how is that shaping how you design messages, really, especially around equity, around sustainability, in the work that you do at every pregnancy?
Absolutely. That's a great question. I'm here in Nigeria. Let's just start off there. My first time in Nigeria.
Interesting.
It's an incredible place. Oh my goodness. And being here in Nigeria to get the firsthand experience of what moms and babies experience here on the ground is critical to be able to lead an organization that prides itself on being on the front lines. And I wish I could go to every country in which our partners are operating, and maybe inshallah I will be able to. But I wanted to start off with the places that are the most critical. Nigeria is one of those places, with it accounting for 30% of the world's maternal mortality rate just from this country alone. It's devastating.
Yeah,
But it also means that there's a systems issue here. And my entire experience being here has not been in which where I'm coming and saying, here are the solutions. It's actually the opposite. I want to see firsthand the work that's happening. I want to meet the moms that are experiencing these birth situations and complications. But I also want to talk to the midwives and the obstetricians and the birthing assistants that are supporting them, and the government officials that are supporting these efforts to strengthen maternal health systems, and the traditional groups, as well as the Islamic clerics and the Muslim scholars who will also play an important role as stakeholders in solving this crisis. And so being able to witness firsthand on the ground the incredible work that's already being done. I don't think we give people enough credit, to be honest, about the work that's already being done in these countries. It's not like there are no people working on this issue. And I think that's even a myth that I would love to dispel more publicly, more externally, especially with Western countries. A lot of people assume that places like Nigeria are doing nothing to help moms and babies, but there's so much happening and incredible work that's happening. So it's more about what are the gaps and how can people and organizations like Every Pregnancy strengthen and support and really drive the change that they need through Nigerian leadership. So we've invested in incredible Nigerian champions and folks even on the Every Pregnancy team and people who are leaders and experts in maternal health that we're following their lead and we're supporting them. So I will tell you that I've been to Pakistan. I saw firsthand multiple clinics and I've met moms who just delivered, moms who lost their babies, moms who barely made it alive, moms who were terrified to deliver because they were so scared about what outcomes could possibly happen. And the experience that it gives me is first and foremost a reminder of my intentions and a renewal of my intentions every time I travel and get to see this work of like, I am so lucky that I'm in a position where I can help anyone and everyone in this issue. And I take that responsibility tremendously seriously. So it's not just one where I see it as great, I'm here to witness something and leave and not think about it again, compartmentalize what I saw and let it go. I take every experience, every interaction, every conversation, and I literally internalize it. And I ensure that our messaging and our advocacy and our programming continues to enhance to reflect the needs of the community. And one thing that's really important to highlight here is that Every Pregnancy works with partners who are indigenous to the communities in which they're operating, people from that country, people who grew up in that area, people who understand, who know the moms, who know that experience. And it's different, right? From country to country, even city to city, state to state, it all changes. And so there's not one cookie cutter way of looking at things. And that's also what I'm realizing is that the messaging that could work in Nigeria would be very different from messaging that could work in Pakistan. And so we even really are thoughtful about that messaging, but we keep that core, which is we know that moms and babies are dying. We know that there are solutions to fix this. We know there are champions and leaders already there. So we uplift and amplify their voices and we drive resources and drive community support to recognize, hey, you have a role to play in this and you can make a difference.
Thank you so much. I was just curious to know if you've been to any other African country or Nigeria is the first.
I've been to Egypt as a quick business trip, but not for Every Pregnancy. So this is actually my first as Every Pregnancy. Oh, wow. And Sub-Saharan Africa I've never been to. So
interesting.
Yeah.
So just going back to the conversation around the systems where all of this happened, and of course it's fragile, funds are shrinking because people are trying to prioritize their countries and trying to focus more on local issues. Of course, there's still conversations around multilateralism and bilateralism and all, but I was just curious with all of these conversations around value for money, cost effectiveness now becomes key issues, not just phrases to words to throw around. And speaking about that, you have a solution that costs just $1 to be able to detect postpartum hemorrhage. I'm just curious, how does it work? How effective is, and what do we need to learn from that about low-cost interventions to save mothers' life?
Well, maybe I should first start off with like a broader perspective, because I think it's going to be helpful for the context setting. For every $1 invested in maternal health, it yields $9 in economic returns for the community and society. That's proven data and facts. So when you invest in women's health, you're not just investing to save her life or to save women, you're actually investing in bettering society overall. And so that's the global context. Then when you think about the interventions, the postpartum hemorrhage drape is actually 50 cents, half of $1. That's how much it costs. And now this drape, for us to explain to viewers who are listening and watching, it's essentially a drape that gets put under a mom as she's delivering that measures blood loss. And so it has the different measurements on it, right? 300 mils, 400, 500. And the idea is for a midwife or birthing assistant, which typically in communities like Nigeria will just use their eye objectively to try to figure out how much is she bleeding? Is it a normal amount? Is it abnormal? Is she in critical care? It's hard to guess as you're in the middle of trying to help her deliver. So this drape, this 50-cent plastic drape that gets put under her, takes out the question. It gives the midwife, the birthing assistant, the direct information that they need to know how much blood loss this woman has had. And as she's delivering, they then can tell when they have to move into critical interventions.
Right.
So part of the postpartum hemorrhage bundle is not just measuring the blood loss, it's also knowing what to activate as soon as she's in critical condition. And it's about a 15-minute intervention with medicine and a lineup that will escalate if she continues to bleed. But ultimately, if it's done within those 15 minutes and all the steps are followed correctly, the mom will 99% be saved, no matter what. So it has proven efficacy in Nigeria, in Pakistan, and everywhere. And it's called the emotive bundle, is what they call it.
Yeah.
And Professor Hadiza Galadanchi, an incredible obstetrician and researcher at ASFAP, is one of the leading people in training people on the emotive bundle. So this 50-cent drape will tell when a woman is in critical condition and enable the support system around her to take action quickly. And that prevents a delay. And the whole reason why moms end up dying in these complications is because of a series of delays. So for us, it's about where do we identify these delays? How do we prevent these delays from happening? And how do we get those resources there? But maternal health is so affordable. And so like you said, everything is a cost. If I'm going to give my donation as a Muslim American, right? In Ramadan, I get so many options to donate. There's so many causes. But if I think about, okay, I want to give $50 to a food basket to feed a family of 5 in a country for the month of Ramadan. That's amazing, right? Or if I want to give $25 to provide hygiene kits to multiple women in another community, great. But then if someone tells me it's not for 50 cents, you can save a woman's life when she's delivering, I will no-brainer give $100 worth of that.
Yeah.
Because you think about that and you think, my $100 is out 200 women.
Yeah.
And you just think like nothing else has that type of return so easily, and life-saving return. The food, the water, a lot of these things sometimes are temporary Band-Aid solutions. They're important, they're necessary for survival, of course. And it's great that people want to give to that. And also, let's expand some space and give a little bit towards even maternal health and see how you can save her life just with that 50-cent donation.
Wow, that's really profound, really,
Yeah.
just to think about it, 50 cents and what difference it can make, because that life saved, there are other lives connected to
Exactly.
her life. But yeah, thank you so much for all the insights. So I would like to bring it all back together where it started, with you, where all this started with you, the personal stories and that inspired you to start this work, and also feeding into the previous works you've done. So I can imagine this is it's not easy, because advocacy, it's demanding, but it's also personal, like you stated earlier. And it's continuous, because of course you keep pushing these messages, you keep advocating, to keep speaking to the right stakeholders. But when you reflect on all the work you've done, you and your colleagues continue to do at every pregnancy, what it has achieved so far, I'm just curious to know what long-term impact means to you, or success, right? And sort of how that continues to drive you to continue doing the work that you do at every pregnancy.
I love that question. Since April of 2025, so just 9 months ago, we've been able to track, based on the funds that we raised in the last year's Ramadan campaign, that we've provided life-saving care to over 500,000 moms and newborns, just so far.
Wow.
Part of that is rehabilitating and building hospitals, reconstructing new maternal health clinics in places like Uganda and Somalia through our partners, Beit al-Mal, or a neonatal maternal hospital that's in shipping containers, being led by our partners in Gaza, Pious Projects, or providing portable ultrasound and providing PPH drapes, providing MMS vitamins. The interventions have been tremendous. So the impact makes me so proud, but it also just shows me that we are just getting started. We're barely scratching the surface. And so for me, long-term success, ultimately, every pregnancy shouldn't have to exist anymore, because we've been able to eradicate maternal mortality. We've been able to put it at 0. And so there needs to be any more advocacy efforts to change mentalities. We have already established giving and priority giving in the Muslim community globally to go towards maternal newborn health. That's the ideal scenario. Now, of course, I know it will take time to get there. So for me, continued success is seeing the partner coalition continue to grow, because without our partners, we truly are nothing. We wouldn't exist. They are the frontline heroes doing this work day in and day out, and so we support them. So we want to have a coalition by 2030 of over 150 organizations that are all committed. We want a majority of those organizations to be in countries like Nigeria, like Mali, like Afghanistan, leading these efforts where they're most needed. We want our coalition to have raised and mobilized over $200 million for maternal newborn health globally, from the community giving, from philanthropic institutions. And I think these are all very feasible. And ultimately, we want to just keep saving millions of moms and babies and preventing these complications and these tragic outcomes from becoming a reality.
Thank you so much, Isra, for sharing this. And I wish you success in all those aspirations. And I hope that you get to achieve them. And hopefully in the next maybe 20 years, 50 years, there won't be a need for every pregnancy anymore, because we've gotten to that vision, or to that place where we are envisioning. All the best to you and the team.
Thank you.
And thank you for coming to this edition of Curated Conversations.
Thank you for having me. Curated Conversations. You guys are amazing. I love this platform, and I love Nigeria. So I'm looking forward to coming back soon.
We look forward to having you too.
Amazing.
Thank you so much, Isra.
Thank you.